to talk about metabolic syndrome. Metabolic syndrome, also known as syndrome X, and insulin resistance syndrome. It is a group of physiological and biochemical abnormalities associated with development of cardiovascular disease and type 2 diabetes. The conditions include high blood pressure, high blood sugar, excess body fat around waist, abnormal cholesterol or triglyceride levels. Having just one of these conditions does not mean you have metabolic syndrome, but it does mean you have a greater risk of serious disease. Now let's discuss its epidemiology. According to an estimation from American Heart Association, more than 9% of US children and adolescents aged from 12 to 19 years, or nearly 3 million individuals, have metabolic syndrome. Among overweight and obese adolescents, this prevalence rate rises to 44%. Symptoms. Most of the disorders associated with metabolic syndrome don't have obvious signs and symptoms. One sign that is visible is a large waist circumference, and if your blood sugar is high, you might notice the signs and symptoms of diabetes, such as increased thirst and urination, fatigue, and blurred vision. Causes. Metabolic syndrome is closely linked to overweight or obesity and inactivity. It is also linked to a condition called insulin syndrome. Normally, your digestive system breaks down the food you eat into sugar. Insulin is a hormone made by your pancreas that helps sugar enter your cell to be used as fuel. In people with insulin resistance, cells don't respond normally to insulin, and glucose can't enter the cell as easily. As a result, your blood sugar levels rise even as your body churns out more and more insulin to try to lower your blood sugar. Now moving towards the risk factors, the following factors increase your chances of having metabolic syndrome. Age. Your risk of metabolic syndrome increases with age. Ethnicity. In the United States, Hispanics, especially Hispanic women, appear to be at the greater risk of developing metabolic syndrome. Obesity. Obese people are more likely to develop metabolic syndrome. Diabetes. Your risk of metabolic syndrome is higher if you have ever had non-alcoholic fatty liver disease, polycystic ovary syndrome, sleep apnea. Complications. Having metabolic syndrome can increase the risk of developing type 2 diabetes, heart and blood vessel diseases. Treatment